Hello, have you ever wondered what the difference is between a nutritionist and a registered dietitian, or nutritionist versus an RD, and all the other letters that there are behind people's names these days that are giving nutrition advice? If you have wondered, you're not alone. This is one of the biggest questions that I get. What is the difference? I would like to start with, what is a nutritionist? Because that's a question that's not an easy one to answer. In some ways it is easy, in other ways it gets very complicated, because anyone can call themselves a nutritionist. Unfortunately, it's legal. And legal in most states to give a self-proclaimed title of nutritionist. So we see on Instagram influencers that are nutritionists, or we see health coaches that are nutritionists, and online people with online certificates that have taken maybe a 6-week online course that can give themselves the title. So while it's legal, it's not necessarily ethical with some of the information that is out there today. So what I would like to transition to is board certified nutritionist. That's what you want to ask. When someone has the title nutritionist, a very simple question would be, what is your background? Where did you get your certificate, or where did you get your degree? To figure out the difference between board certified nutritionist and someone that says they're a nutritionist. So what is a board certified nutritionist? Well, I will tell you, I'm probably a little bit biased, and you might even notice behind me I have my master's degree certificate and my license as a board certified nutritionist on my wall, which I hang very proudly. So a board certified nutritionist is someone that has a minimum of a master's degree in clinical nutrition, not just a master's degree in anything, but in clinical nutrition, has passed a rigorous exam, a board certification national exam, and has completed a 1,000-hour internship. And that internship can be with a private practice. It's broken out, those 1,000 hours are broken out into community work and education work and private practice. So that is what it takes to become a board certified nutritionist. So if those two words aren't in front, then that's a designation of something else. And what is a registered dietitian? A registered dietitian is a person who is a nutrition professional that has a bachelor's degree and has completed 1,200 hours of clinical internship, usually in a hospital. And typically registered dietitians do work in hospitals, and they work in a traditional medical facility and approach to nutrition. However, I've seen lately on many different social media outlets that there are registered dietitians that are taking a little different approach. They're taking an approach of the non-traditional and more functional approach to nutrition, which is wonderful to see. So I think in 2024, it's going to change for registered dietitians that they will also need a master's degree. I'm not sure what that degree needs to be in or what that program is all about. It's something new that the American Dietetics Association has established. And we will learn more about that in the future. But a nutritionist, a board certified nutritionist, takes a less conventional role. What they do is work typically in a functional medicine approach, so that they can help their clients and patients, and in a functional approach, so that they are approaching health and nutrition that they want to prevent more than to treat, or prevent disease or manage disease. So those are important aspects as well. I have a bunch of other designations that you might be seeing, and that is IIN, C2N, CNN, ITHTSN. There are a number of different designations of things that people can qualify for today and put those letters after their name, and they all have a little bit of a different scope and approach. Usually they're about 200 hours in training. So again, what you want to do if you're looking for someone who is a credentialed professional is to ask what their background is. I'm going to put a link in the video below, and it's going to be a link to some really wonderful information, more than I can even tell you here in 5 or 10 minutes, about the difference between RD and board certified nutritionist. And there is a difference, and there's a little bit of a different approach, although like I said, there are registered dietitians that are now becoming more in the public. I'm going to also be posting another video that will show my portfolio, what I do, which is research, public speaking, one-on-one nutritional counseling, teaching of cooking classes. It's very broad. The job opportunities for board certified nutrition are not the same for RD. An RD can work in a hospital and can get benefits and vacation pay and so forth. And a board certified nutritionist probably wouldn't gravitate to that type of job and go more into their own private practice in public health. So I have a document in front of me. I just want to repeat what I was saying. An RD is a food and dietary professional making up the largest group of nutrition professionals. They are certified by the American Dietetics Association, sometimes known to be a little controversial because of where their funding comes from. But RD is a recognized, nationally recognized professional credential available through the commission. They need a bachelor degree, 1,200 supervised clinical hours, and pass their exam with 145 questions. Certified nutrition specialist is a nutrition professional with an advanced degree from a fully accredited university in nutrition, not from a university that's not accredited. It's nationally recognized professional credential, and it's a master's or doctorate degree, 1,000 supervised clinical hours, and 200 question board exam. I remember leaving my board exam. I had no idea how I did. It was rigorous. My brain was really tired after that one. So take a look below if you want more information and in-depth information in writing. I'm going to put a link there, and subscribe if you like the information that you're getting. Please do subscribe. Love to have you. Thank you.